Hello, Assalamu alaikum. Welcome to another series of MCAT 2020. In this video, we will be discussing AIDS, which is caused by HIV viruses, and this is a disease which is being represented as a taboo, whatever it is known in Pakistan. People think it's just caused by sexual contact with people, and that's why it is seemed to be bad, and the people having AIDS are maybe involved in those sort of activities. But I have to clear that it's not just because of the sexual contact, which is being a lot enforced a lot, while the HIV virus is transferred with the exchange of body fluids, and the exchange of body fluids can occur with many other ways besides sexual contact. I know sexual contact is also one thing through which semen goes out and there is a passage of fluid, but there are many other ways due to which there is passage of fluid, body fluid, such as, for example, there is a barber who is cutting and making the beard. So making during beard making, he just cut his skin off, and he was an AIDS patient, and again he did not sterile his equipment, and then use those equipments on another client, which made that client get AIDS, and he also made a cut in that client, and the blood of that client got HIV virus, due to which that guy got AIDS, and people are and we can say the society thinks that he may be involved in any sexual contact, that's why he got AIDS. So that was the first thing which I thought I should clear before teaching what is AIDS. So AIDS is caused by HIV virus. Whenever we talk about any disease, we take out some headings and study about those things, and these things are very necessary from the exam point of view, as well as when you become an adult doctor or physiotherapist or whatever the medical field you choose. You really need to know about these things under any disease. It can be any disease. So cause, first of all, you must know how this disease came, or what sort of virus or what sort of pathogen caused this disease. Physiological cause is the cause. We term it physiological because such as HIV virus attacks us. Now what does it do inside the body to make that person ill? That's the physiological cause, and that's a physiological reasoning as well. Symptoms. What are the symptoms? What are the difficulties a patient is getting while having infected by AIDS or any other disease are the symptoms. For example, if you go to a doctor, you go to the doctor because of a symptom. If I got a pain in my head, then I have the symptom that I have a lot of pain in my head. Doctor asks you, from how long are you getting that pain? I told him, I am getting it from 3 to 4 days. I am having a severe pain. So that what I am trying to tell them, the symptoms, the problems I am facing. Treatment. Now treatment, as you all know it, so I do not have to mention what it is. Prevention. How can you prevent that disease to occur or to arrive to every other person? Such as coronavirus is now approaching every new person. It's spreading like a flood. So how can we prevent from any disease? All disease have the ability to spread. Some have low abilities while some have huge abilities, just like coronavirus. Causes. It is caused by HIV viruses. So first of all, we studied the cause. Cause is that HIV viruses is a type of viruses. As shown in this picture, this is HIV viruses. I know in the corners they are flowers, but maybe it is going to be the protein, but the figure has been made. Inside it has its DNA, and outside are the proteins glycoproteins, which tells that this is a virus. So it is caused by HIV virus. Physiological cause. What is the physiological cause is of AIDS of HIV virus is that they enter the body and they attack the immune system of the body, while it is going to affect the lymphatic system. In lymphatic system we have two types of cells, T cells and B cells, which we are going to study later in the second year book, and this is the first year book's topic. So just ignore it. Just know that these are some type of lymphocytes, which are also a type of white blood cells, are police of our body. Okay, so these immunes, what do HIV virus do? Let's get back to the topic. They affect the T cells. Now what do they do to the T cells? The T cells have various types, from which some are the T killer cell, and some are the T helper cell, and some are the T activator cell. So the T activator cells are going to be the host of HIV virus. So they attack the T activator lymphocytes, and what happens when they are going to be dysfunction? Their dysfunction causes dysfunction of the immune system, because they are going to activate the T killer cells, and then T killer cells are going to kill the pathogens. And let me tell you why lymphocytes are so important, because lymphocytes are those white blood cells which remember that which disease comes in and which disease goes out. These are very specific to know which of the cell entering the body is the cell of the we can say of a virus, cell of a virus, or it's a cell of their own body. So they help identify any of the pathogen. So without lymphocytes, without T lymphocytes, we can say our body police is likely to be blind. So that's the case why AIDS is very difficult. And what does it do? The patient is now unable to fight against any sort of pathogens, as its immune system is hijacked by HIV viruses. Now the patient is prone to get any sort of disease. But there are some of the disease which are very common, so we will study those in the symptoms. While symptoms are still going to be very different in different patients. Different patients will have different symptoms. Some patients will be having continuous flu. Some patients are going to have continuous temperature. It depends what sort of viruses they are prone to, or they are getting or coming into their bodies, because they cannot fight with the pathogens as their immune system is not compatible. Transmitted by transfer of body fluids, we have discussed that. And body fluids transfusion is being done by many methods. You just have to figure it out. Just think about the things from which there is transfusion of fluids. All those things are going to affect AIDS. For example, blood transfusion in the blood banks. If that blood is containing HIV virus, then the receptor of the blood is also going to get AIDS. One more thing we have over here, which is going to be sexual intercourse. Of course, that's a major thing which I have told you. People think that's the only thing, but that's just a major thing. Okay, that's not the only thing. If you have a child who have AIDS and he got a wound, you also got a wound, but you guys hug each other because you guys are alive. So there is a transfusion of HIV virus from the kid to the mom. It doesn't mean that that kid was involved in sexual intercourse. After that, we have another case in which a mom with HIV viruses, if she get pregnant and give birth to a child, that child will have the blood of her mom of not her or his, whatever he is going to be, whatever the gender is. So of his, let's suppose it's his. So he will get the blood of his mom, and that's why he can get AIDS. So there are various things in which there is the transfusion of blood. You can brainstorm over this topic. Symptoms. Now we have a lot of symptoms which are from which some of the common symptoms are going to be discussed over here, which Google tell us that rapid weight loss. Weight loss is going to be rapid, recurring fever, profuse night sweats. We have extreme and unexplained tiredness and prolonged swelling of lymph glands. Like lymphocytes are unable to work properly. So when they are not going to properly work and they are going to be hijacked from viruses, then they must swell in response. In the armpit, groin is the part of your stomach, and neck. Diarrhea that lasts for more than a week. Soreness, which is compatible, relatively similar to the swelling. Soreness of mouth, anus, and genitals, and pneumonia. Pneumonia is very common. It's very common in AIDS to find pneumonia, because air contains a lot of viruses, bacteria, from which our body keeps fighting. But the patients of AIDS, cannot fight with those bacteria, those viruses, which they are going to get from the air. So whenever you breathe, you take in bacteria. Okay, so because bacteria, viruses, these things are in air, so that's why they are very prone to pneumonia. One more thing, which is dementia. So their brain cells undergo dementia because some of, in 50%, as a book recommend, that 50% of the patients are going to get dementia in their brain cells, due to which they are going to die, because their brain is going to have a dysfunction, and these HIV viruses will attack the brain cells and just finish them and make them disabled. Treatment. Now, what is the treatment for AIDS? Well, there is no treatment yet for AIDS, while we use some medicines which suppress the effect of AIDS. Okay, so it's not a permanent treatment, but it's like you are controlling your condition. Like if you have asthma, you do some exercise and control your conditions. Likewise, if you have AIDS, you get some medicines to control your AIDS. While you cannot permanently get rid of it, you have to eat those medicines throughout the life. One more thing which is going which has to be discussed over here, that we can make vaccines for AIDS. If you think of it, any disease like polioviruses, we have vaccine for polioviruses. That's why everyone is safe from poliovirus. Then why not make vaccines for AIDS? We do not make vaccines for AIDS because, how do you know how vaccines work? Vaccines are going to work in this manner, that whenever the body get exposed to the virus, it just identify that virus, and that identification is kept in your brain, in your lymphocytes, in your T memory cell and B memory cells. Now this memory helps them to identify anytime any other polioviruses enters your body, or any other similar virus enters your body. They are just going to finish it as soon as possible, because they know that's harmful for their body, and they have been exposed to it before while vaccinations. So that's how the vaccine works. But in this case, in AIDS, the virus HIV, this virus is very complicated. The circular disc around it are very harmful. And what's so harmful, or not, they are not harmful, sorry, they are we can say they are technical. So what do? They keep changing their glycoprotein, and that's the only particular thing by which a body remembers a virus. A body remembers a virus from the protein anchored outside of their membrane, and the protein anchored outside of these viruses are always changing. So they keep changing their protein. That's why we have never been successful to make a vaccine, nor we can ever make a vaccine for HIV viruses if they have so many types of proteins. The drugs used for suppressing AIDS are azidothymidine or zidovudine, formerly known as AZT. These are the name of chemicals, that's why they are quite difficult, which slows progression of the disease and can attack the virus even in the brain. So they are quite successful. They can also slow down the process if the viruses are attacking the brain cells. If they are attacking the brain cells, these medicines are capable of suppressing that virus and making that virus dysfunction, so or stop their metabolic process. That's the only way they are going to work and stop all the bad processing inside the body by viruses. Prevention. So what is going to be the prevention? How can I prevent myself from getting AIDS? First of all, always use sterile equipment. Even if you are at a clinic, if you are going for a checkup in the doctors, or you are going through an surgery or whatever it is, just ask your doctor, are your equipments sterile or not, or verify that where are you going, is that place legit or not, if it's maintaining its standard or the necessary things, how much sterilization is being done to their equipments after every patient goes away, after it is going to be used at one patient. So these are some of the preventions for AIDS or HIV viruses. And now I have to discuss about this red line. The reduction in the spread of HIV could be brought about by the use of clean needles and sterilized syringes by drug addicts. So I really think that this thing is very funny, that how our book represent that the prevention could be done if you use drugs with a sterile syringe. It means they are motivating drug addicts to keep using drugs. Okay, kid, hi, you are using drugs? Good, keep using it, but make sure you use sterilized syringes, okay? One time using syringes which are sterilized. So that's how you are going to be perfect for using drugs. Drugs are safe, they are very healthy. So that's why I have put it this line in red. So our book has mentioned in the first line of the prevention heading, under the prevention heading, that we can save people from HIV viruses by asking drug addicts to use drugs with sterilized syringes. Okay, using drugs is okay, but just use sterilized syringes and needles. That's all they were trying to say. Well, the real prevention is going to be careful with the exchange of fluid, with whom you are going for a sexual intercourse, or with whom just don't touch anybody's blood or anything. If you find any blood or any body fluid anywhere, just stay away from it, and make sure whenever anything is going to be inserted in your body, it has to be sterilized. That's the only way you can prevent yourself from AIDS, because AIDS is still increasing its numbers, even after knowing that AIDS is something which can be prevented just by not letting anything dirty enter your body. That's how you can save it, enter your blood. Whenever you're going to blood transfusion, you are very weak and you need blood, so doctor asks you for getting blood. So make sure to find a donor yourself who is not a AIDS patient. If you are unable to find your own donor, then go to the blood banks, but I will always prefer to check from which blood bank are you taking, and are they safe, and do they take care of all the precaution before draining the blood from any of their donors. So these are all the precautions you can make for the prevention from AIDS. Thank you so much for watching my video. I do not have any thank you slides. I am really sorry. I keep doing these sort of mistakes, and please hit that subscribe button, because it's very difficult to speak in English and make English tutorials for you while my mother tongue is Urdu. And if you like the video, push that like button. If you have any suggestion in your mind which can make my videos stand out, then you are most welcome. Thank you so much for watching. Allah Hafiz.